Hello and welcome to the introduction of rational use of drugs, mostly in Europe. Of course, rational use of drugs comes with a lot of challenges, basically aging population, changing doctors, over and under medication, higher price of new medications that are being developed, and of course different individual characteristics. The population of Europe is going to be a lot older in the future, which means that we are going to have a lot more people with polypharmacy, which means they are going to have at least 4 different kinds of prescription drugs in use. Another problem is with the changing doctors. Some people run from one doctor to another, meaning that the different doctors do not know if the other doctor has already prescribed something else for the same disease, or they don't know if the other medication the patient is using would cause interactions with the drugs the doctor is prescribing. And of course, that's not the only problem. Also, some foods may interact with drugs. And then there's this quite new medical herb mumbo jumbo thing, which means that people like to treat their illnesses naturally, but that's also going to cause some problems because most of the time these medical herbs have not been tested as well as these drugs that are made by medical companies. Then there's the over and under medication problem. Over medication might be caused to some extent because of pharmaceutical companies that try to sell their products as much as possible, because that's the way it's going to be in a capitalistic world, meaning almost every country in the world at the moment. Because of the pressure from pharmaceutical companies, it may cause some doctors to prescribe medications that are not perhaps needed. They are prescribed for just in case. And most common of these are antibiotics and strong painkillers, which are causing some problems. Then there's also the problem of under-medication. Most of the time this is caused by the patient's fear of adverse effects. This would be quite good to remember that every medication might have adverse effects, and most of the drugs are tested, and it should not be a reason to not at least try the medication, because only then you know if you're going to get the adverse effects or not. And always the aim of the drug use would be to get more benefit from it than harm. And then there's the economic status. In many countries, there are many poor people who don't have the money to buy the more expensive medications. And for example, in new medications, the exclusivity of them is going to make them even more expensive. And because of this, economic status might affect effectiveness of the new treatment. And differing from a country and the indication of the medication, it might take 5 to 10 years before the other pharmaceutical companies can bring their own generic alternatives to the market and then lower the price. Then there's always the different kinds of genetic and other differences between individuals. Sex, race, and body weight always, well not always, but often, they affect the drug metabolism and or excretion. Then there's also the gene polymorphism, which is most often caused by the liver. There's a lot of different kinds of enzymes in the liver, and many drugs are also metabolized in there. And there might be from slow to ultra fast metabolizers. And one example of this is quite commonly used painkiller codeine, which in itself is not a painkiller. Only after it metabolizes in the liver as morphine, it's going to alleviate the pain. But there's some, like 1 to 2% of people who have an ultra fast metabolism of codeine, which means that they are going to get a lot more morphine in the system than most people would. Even so much that it might be on the toxic level of morphine, which means that you may stop breathing because you're going to get an overdose of morphine. And usually, if the drug is metabolized in the liver successfully, then it's going to be excreted by the kidneys. Some drugs are not even metabolized, they are just excreted through the kidneys into the urine. And it's also important to know that liver and kidney function decrease with age. Of course, there are also another different kinds of genetic differences with this. So what solutions do we have for these problems? For example, cooperation between healthcare professionals is a good way to start. Another would be to make medical evaluations. If the person has a lot of different kinds of medications, or if the medication is not working properly. And basically, cooperation means the cooperation between a pharmacist, a doctor, and a nurse. From these, the doctor is of course the one who prescribes the medication. The pharmacist is the one who gives you the medication and gives you advice how to use it. And the nurse is going to be the link to the doctor and to the pharmacist, because most people are going to see the nurse a lot more often than they are going to see their doctor. So what are medical evaluation services? The more easier one is medication assessment, which depending on the country is made by a doctor or a pharmacist. And in that service, they are going to tell you how you should use your medications in the right and safe way. They are also going to check if you have any interactions between your medications, including your prescription medications, over-the-counter medications, and also possible supplements that you're using. And during this medication assessment, they might also see if you have double medications, which means that different doctors would have prescribed something with a different brand name, but the effective drug component would be the same. And the more extensive one is a medication review, which is usually made in cooperation with at least the doctor and the pharmacist, and it might include the nurse as well, meaning that the pharmacist is going to use their knowledge of the drugs to be used in evaluation by the doctor. And of course, the nurse is going to be the link again between the doctor and the pharmacist, so that the doctor is going to get the information how the process is going. And also in the medication review, there's a more extensive search into the patient commitment issues, if there's something like that. This might be caused by if the patient has to use the medications more than twice a day. It's quite common if the person has to use like eye drops up to 6 times in a day. It's not going to last for very long because the person does not want to take the medication that often during the day. So what can you do yourself? The number one thing, keep up-to-date list of your medications. If for some reason you're going to another doctor, you still have your medication list with you, and the doctor can check from there and prescribe a drug that doesn't have interactions with these medications. Another easy way is to ask from a healthcare professional if something is bothering you. Don't go to online sites to ask from another people where basically anyone can answer you. And remember to tell the doctor if you have any drug allergies. For example, penicillin allergy is quite common in people. And another one would be to remember to tell the doctor if you have severely limited liver or kidney function, because as I said, this might also affect the metabolism and excretion of the drug components. So this was just a short introduction, and I hope this would be meaningful for someone. I might be doing these kinds of things more in the future. So thank you for watching this.